You know that sound, right? That high-pitched, almost musical whistle when someone breathes. That's wheezing. And yeah, it can be pretty unsettling to hear. But here's the thing. It's not just some random noise. It's actually a message, a really specific signal from the body that something's going on deep inside the lungs. So today, we're going to learn how to listen to that signal, to really hear what it's trying to tell us. So here's our game plan. First, we're going to start with the sound itself. What exactly is it? Then we'll get into the science of the squeeze, what's actually happening to make that noise. From there, we'll become detectives and learn how to decode the different kinds of wheezes. We'll also cover the usual causes and, crucially, the red flags. And finally, we'll see how all this information helps doctors go from signal to solution. All right, let's dive in. First things first. Think of this whole thing like we're solving a medical mystery. And that wheezing sound, well, that's our very first clue. And this really is the big question, isn't it? What is that voice telling you? Because I promise you, that sound is anything but meaningless. It is literally the voice of the airways, and it has a very specific story to tell about what's going on inside. Okay, let's get a proper definition down so we're all on the same page. Medically, a wheeze is this continuous, high-pitched kind of musical sound, but the most important part of that definition is the why. It happens because air is being forced through pipes, the airways, that have gotten too narrow or are partially blocked. And this is a super important point to get right. Wheezing isn't the disease itself, not at all. It's a physical sign. It's a symptom, just like a fever or a rash. Think of it like a big, bright, flashing neon arrow that's pointing to the real problem, which is usually some kind of obstruction down in the lower airways, deep inside your chest. Okay, so we know what it is, but how is that sound actually made? Let's go a little deeper, right inside the airways, to really get the physics of what's going on. It's actually a pretty simple three-step process when you break it down. First, something causes the airway, the tube, to get narrower. Then, because that opening is smaller, the air moving through it has to speed way up. It's exactly like when you put your thumb over the end of a garden hose. And finally, that super fast airflow makes the walls of the airway start to vibrate. And that's the musical sound we hear as a wheeze. Simple as that. So the next logical question is, okay, what causes the airway to get narrow in the first place? Well, there are basically four main culprits. First up, you've got something called bronchoconstriction. This is where the little muscles around the airway just clench up, like a fist, and squeeze the tube tight. Second, there's mucosal edema. That sounds complicated, but it just means the inside lining of the airway gets all swollen and puffy. And then, of course, you can have just stuff in the way, intraluminal secretions, which is mostly just a buildup of thick mucus clogging the pipe. And last, there's external compression, which is when something on the outside of the airway is literally pushing on it and squishing. You ever notice that you almost always hear wheezing when someone's breathing out, not in? There's a really simple reason for that, and it's all about physics. When you breathe out, the pressure inside your chest naturally goes up. That increased pressure gives those already narrow airways an extra little squeeze, which makes it even easier for them to start vibrating and making that sound. All right, now this is where the real detective work begins. Because, and this is super interesting, not all wheezes are created equal. By paying close attention to when the sound happens during a breath and where in the chest it's coming from, doctors can get some massive clues about what's really going on. So let's talk timing. It's a huge giveaway. If the wheeze only happens on the exhale, when breathing out, that's what we call an expiratory wheeze. And it's a classic sign of things like asthma or COPD. Now, if you hear it on the inhale, that's an inspiratory wheeze, and it usually points to a problem much higher up in the airway. And what if you hear it both ways, in and out? Well, that's called a biphasic wheeze, and it's a big red flag for a fixed blockage, something that's just stuck in there, like a tumor or maybe a piece of food someone accidentally inhaled. And it's not just about timing. Location is also a major clue. Imagine a doctor listening with a stethoscope. If they hear that wheeze in just one tiny specific spot, that's called a localized wheeze. It tells them there's probably a single blockage in one little branch of the airway. But if they move the stethoscope around and hear that same wheezing sound everywhere, that's a diffuse wheeze, and that points to a much more widespread problem that's affecting the whole lung system at once, like a big asthma attack or a serious allergic reaction. Okay, so we've learned how to decode the sound. Now it's time to connect those clues to the actual culprits. Let's look at the usual suspects, the most common conditions that cause wheezing, and probably the most important part, how to know when it's a real emergency. So, who are the common culprits? Well, asthma and COPD are definitely the big ones, but you'll also see it with temporary infections like bronchitis, or a condition in little kids called bronchiolitis. But here's where it gets really interesting. It's not always a lung problem to start with. Anaphylaxis, a massive allergic reaction, can cause wheezing. Even heart failure can do it by causing fluid to back up into the lungs, which is sometimes called cardiac asthma. All right, let's pause here because this is probably the most critical question we're going to ask today. A lot of the time, wheezing is manageable, but sometimes it's a sign that you need to get help and you need to get it now. So what are those signs? Okay, these are the red flags. You need to seek immediate help if the wheezing comes with severe difficulty breathing, or if their skin or lips start to look bluish, that's called cyanosis. If you can see them using all their neck and chest muscles just to pull in a breath, that's a huge warning. But the scariest sign of all is actually the end of the sound. If someone is obviously struggling to breathe and then the wheezing just stops, that is terrifying. It's called a silent chest, and it can mean their airways are so tight that no air is getting through at all. It is an absolute medical emergency. All right, let's bring this all home. How does a clinician take all of these clues, the sound, the timing, the location, all the other symptoms, and put them together to finally close the case and land on the right treatment? The main principle here is actually pretty simple, but it's so important. The goal is not just to make the wheezing sound stop. It's not about silencing the alarm. The goal is to treat the airway obstruction that's causing the alarm to go off in the first place. It's all about fixing the root of the problem. And the path to a diagnosis is really a logical, step-by-step process. It always starts with the patient's story. Asking about their history, triggers, smoking habits. Then comes the physical exam. After that, they'll usually do some initial tests, like checking oxygen levels. And if they still need more clues, that's when they bring in the bigger tools, like more advanced breathing tests or a chest x-ray, to really zero in on the cause. And really, this quote just sums it all up perfectly. Wheezing is the voice of a narrowed airway. The real key isn't just hearing that voice, it's understanding why it's speaking, where it's coming from, and maybe most importantly, how urgently you need to listen and act. So there you have it. We've decoded the signal, we've learned to listen to the voice of the lungs. So the final question I have for you is this. Now that you can interpret this signal a little bit better, what are you going to do with that information?